Almost 350,000 women received breast implants last year. It is the #1 cosmetic procedure in America, but when it goes wrong, the patient can be scarred or disfigured for life. A doctor in Santa Monica says he's found an answer, and 2 of his grateful patients agree.
I spent years basically bruised and waiting for scars to heal. It was a nightmare.
I couldn't pick up my kids. I couldn't hug them. My everyday life was misery from morning till evening.
Marina Maximova is an actress, model, former Miss Russia. Susan, also an actress, asked us to conceal her identity as she grapples with the fallout from a decision she now regrets. Marina and Susan, both victims of complications of their quest for perfect breasts.
I actually get the worst of the worst breasts.
Santa Monica cosmetic surgeon Mark Berman, the doctor who eventually saved their breasts, repairing severe deformities caused by a condition called capsular contraction. It happens when the body reacts to breast implants by surrounding them with painful scar tissue.
When you do a breast implant, most people are going to have a good result, but it's completely unpredictable.
A real problem.
You don't know who's not going to have a good result.
Up to 1 in 4 implant patients develop scar capsules. For Marina and Susan, the pain and deformities were far beyond what they anticipated.
My breast rode all the way up to my collarbone.
To try to undo the damage, she underwent 8 surgeries with some of the world's best-known plastic surgeons.
I've been to people that are supposedly breast geniuses.
Spending far more than her initial $10,000 breast implant budget.
I would say about $150,000.
Marina, who had 14 surgeries, also went to well-known surgeons.
Who made it even worse?
Physically and financially, her tab.
It'd be under $250,000. Nobody discloses the risk to you. That's the ugly truth of it. I had to have reconstruction if I wanted to look like a woman or be disfigured for the rest of my life. And disfigured, I mean real bad.
It's really amazing what can happen once the body starts scarring down around these implants.
Removing the implants gets rid of the pain, but
I wasn't ready to look like what I was going to look like.
If you remove it, you basically have an empty sac.
12 years ago, Dr. Berman came up with a solution designed to stop scars from encapsulating implants, a pouch made out of a Gore-Tex-like material. It's called the pocket protector. When a breast implant is placed inside, the pocket protector acts as a barrier between the body and the implant. The pouch material isn't new. Heart surgeons have been using it for decades.
That was used as aortic grafts, vein grafts, hernia patches.
Once Dr. Berman figured out how to use it in the breasts, he realized
I have something that actually works.
Other doctors not so excited when Marina asked around.
At least 4 doctors, very highly qualified, famous plastic surgeons, told me it's never going to work. This material is not made for breast implants.
Marina finally got her pocket protectors about a year ago. Susan got her pocket protectors 5 months ago.
It's as soft as the day it went in.
The problem is, I'm the only person who can do it.
Until the pocket protector gets FDA approval, Dr. Berman can't sell them to other doctors.
Somebody comes up with a new idea, a new paradigm, it's difficult to get people to accept it.
At the point where I found Dr. Berman, there was no other option for me.
Here's what Marina looked like before. Here's her bust line after pocket protector surgery. Here are other cases. Without scar tissue, breasts hang lower. They're not quite as lifted as before. But for Marina and Susan, the trade-off was worth it. For the first time in years, they can't feel their implants.
I can hug someone and not feel a ball.
It's me. Now it's me. It's not something attached to me. It's me.
Dr. Berman hopes to get FDA approval within a year. Until then, pocket protectors are considered experimental.